that we know can be attributed to a higher percentage of aggressive triple negative breast cancers occurring in women of African descent. We don't know why, but we do know that we're going to need to solve for that for earlier detection and better treatment strategies. So we know that's part of it. But certainly access to care has to be part of this as well. So, our women of different demographics and different geographies getting access to the same equitable cancer detection and cancer care. That is something we can and must understand and solve for. That's a area of concern. When we look at cancer, let's unpack a couple things about breast cancer because I think this is important for the story. We talked about that 33% overall decline in cancer mortality in the US since 1991, but cancer is 200 different diseases. So if we look at breast cancer, it's actually a 43% reduction during that time. So breast cancer as a whole is kind of outpacing the norm. So this investment in innovation has been really, important. But we also see this uptick in incidence of more women being diagnosed with cancer. You talked about the tsunami, Dr. Baskies, and of this year of more than 300,000 women being diagnosed. That's going to rise. And that may confuse people sometimes. Mortality is going down, but the more people are getting it. Well, we're living longer. So the longer that you live, the more likely you are to develop cancers, and breast cancer is one of those. We're also seeing a rise in obesity in the United States, and we know that obesity is an underlying risk factor for breast cancer. So that we might have expected, and it's about a 1% year over year increase in the number of women getting breast cancer. Okay, but who's different than that norm? We're very concerned about two populations. One are Asian American and Pacific Islanders. We've seen that group a 2.5% increase year over year in incidence. So that women of Asian descent or Pacific Island descent are getting breast cancer at a much faster rate than the norm. We don't know why. The other group we're very worried about is the under 50 population. So we're consistently seeing this shift in a number of cancers, 17 different cancers, breast cancer being one of them, of happening earlier and more and more frequently in women under age 50. Back to your 1975, Dr. Baskis, you probably didn't see that many women under 50 who had breast cancer. Now we do. And we know that that group is rising at about a 1.4% year over year. So something we have to pay attention to. And until we understand the why, what we need to do is make sure that if we're going to solve for these cancer inequities, to make sure that people get screened, they understand screening guidelines, and they also understand their own personal risk. Screening guidelines are by definition for people of average risk, but increasingly people are able to assess whether that is them or not. Do you have a family history? Do you have a medical history? Do you have an exposure history? Do you have a genetic risk that changes you into being a more high risk breast cancer individual? I am one of those women who's a more high risk breast cancer individual. My screening plan is not the same as someone who is of average risk. And so, empowered with that knowledge, I hope that I will prevent myself from developing an aggressive breast cancer